Welcome everybody. Um, this is the first session of the Fertility Guide webinar series for 2026. We do have six more webinars that are already scheduled, and we're very excited to kick this one off. Today is about acupuncture and the true support it can give patients when it comes to fertility. And Anne is a star in this field, and she'll continue to tell us more about that.
I thought you were wanting me to tell everybody what a star I was. And you wanted more information on that. I was like, this is so much better than my education when I was growing up. Um, okay, so the way I think I'm going to frame this, everyone, is I'm going to give sort of an overview in terms of how acupuncture can support fertility from an evidence-based perspective. Um, I have many peers who do amazing work in the field of acupuncture, but I do take a very different approach, I think, than the majority of them, as I use the Chinese medicine framework more from a philosophical standpoint as opposed to an absolute. And what I mean by that is, for example, I think that the philosophies of Chinese medicine are a wonderful starting point. And I think that there's tremendous amount of knowledge in those philosophies alone. A perfect example of this would be the connection of certain acupuncture meridians. So, for example, the lung and the large intestine in Chinese medicine, specifically as acupuncture meridians, are paired, which if you were to just look at that pairing from an immature lens, you would think to yourself, what on earth would the lung and the large intestine have anything to do with one another? And that was my mindset, most certainly when I was a student. But then as I have now gone through years, now almost several years, over a decade, since I graduated, there's a clear connection between your large intestine health or your microbiome in your large intestine and your small intestine, and what that means for your overall immune health. And a lot of the time, the understanding of improving your GI to improve your overall immune system is a well-known and understood philosophy now that was understood in Chinese medicine from a philosophical standpoint long before we understood that the majority of your immune system is in your gut. So from a philosophical lens, from even a map lens, like destination, for example, it's really important to use Chinese medicine philosophies. However, it was very long-winded to say that I use it as more of a map and less of a day-to-day directive. So I'm going to give you sort of an overview of how I treat and sort of my reframing of acupuncture. And then at the end, we can open the webinar to questions that you might have, and I will do my very best to answer them without going on at length, just to hear myself talk, because I'm a star. Okay, here we go. So essentially, when we talk about acupuncture and fertility, the most accurate framing isn't that acupuncture necessarily treats infertility, but that it can support the systems that govern reproduction. So the nervous system, the endocrine system, blood flow, and your immune signaling. Fertility, as we know, and something that I really appreciate about, for example, clinics like Tripod, is that fertility doesn't happen in isolation. Ovulation, implantation, early pregnancy, they're all influenced by stress physiology, autonomic tone, inflammation, hormonal signaling, and acupuncture sits at that intersection. So one of the strongest and most consistent findings in acupuncture research is its effect on the autonomic nervous system. Chronic stress activates the sympathetic nervous system and the HPA axis, increasing cortisol, and these signals then interfere with GnRH pulsing, ovulation, luteal function, and blood flow to the ovaries and the uterus. Multiple clinical studies show that acupuncture can reduce sympathetic tone and increase parasympathetic activity, which shifts the body towards the rest and digest state that everybody knows about, that is significantly more supportive of reproductive function. In an IVF population, acupuncture has been associated with reduced anxiety and perceived stress around treatment specifically, which is clinically meaningful in itself and biologically relevant to the reproductive cycle. Blood flow and reproductive environment. Another important mechanism is improved pelvic and uterine blood flow. Studies using Doppler ultrasound have shown changes in uterine artery impedance and perfusion following acupuncture and electroacupuncture. And improved blood flow means better oxygen delivery, improved follicular fluid environment, enhanced endometrial receptivity, which then provides a more plausible physiological explanation for why some patients experience improved cycle quality or treatment tolerance with acupuncture. It's so interesting. I had a patient come today who had her lining was 6.8 and it was trilaminar, but there were trace amounts of fluid. And her husband said, "Go see Anne, she'll fix it." And I had to reframe this because I can't fix that. But improved blood flow could potentially improve outcomes, especially in situations where you need to improve circulation and where it is important that you have proper hormone signaling, such as right before transfer. Ovulation support, specifically, but not limited to PCOS. So one of the most encouraging areas of research in terms of acupuncture is actually in ovulation support in PCOS. Repeated acupuncture and electroacupuncture treatments have been shown to increase ovulation frequency, improve menstrual regularity, which makes sense given that you have just improved ovulation frequency, and modulate LH and androgen levels in women with PCOS. A randomized control trial published in the American Journal of Physiology, Endocrine and Metabolism demonstrated higher ovulation rates in women with PCOS receiving repeated acupuncture compared with controls. That was in 2000 and then repeated in 2009. This suggests that acupuncture may help normalize neuroendocrine signaling and ovulatory dysfunction, particularly when treatments are consistent and repeated over time. So I always tell patients that that is roughly between 7 and 10 days in terms of frequency. I have had a lot of patients who have come to see me after seeing other practitioners who insisted that they needed to be seen 2 to 3 times a week. That isn't what the research shows, and I would suggest that unless you're going to quell your anxiety or improve things like sleep or digestion, which may be interfering with your overall well-being, those are more immediate, and you'll feel the more immediate side effects, positive side effects of that, and feedback from that. But otherwise, 7 to 10 days is the frequency that is proven in terms of looking at the actual research. Another area receiving increasing attention, and one that I'm particularly interested in, is the ovarian hormone markers. So recent systematic reviews and meta-analysis in women with diminished ovarian reserve or premature insufficiency have reported lower FSH, improvements in estrogen, and a modest increase in AMH or their AFC, more often than not correlative. This is particularly important for me to really highlight because my reputation as a witch has grown over the years, and it is due to these hormones in particular and the ease at which they are now being tested. So patients have gone, they have a baseline, they know what their AMH is, they know what their FSH is, they know what their AFC is. They come see me at a fairly regular interval for a certain number of months, and lo and behold, these levels have improved. Ah, the witch! No, science! So acupuncture is known to, according to a 2023 study and then repeated in 2025, meta-analysis of randomized trials in diminished ovarian reserve, they found that acupuncture is associated with improved ovarian hormone profiles And a 2024 meta-analysis of premature ovarian insufficiency similarly reported favorable hormonal changes across multiple trials. Clinically, this suggests that acupuncture may support neuroendocrine regulation and the ovarian environment, which is very important. I'm sure many of you were just chomping at the bit when the 2025 study came out saying that women's eggs aren't racking up as much egg-related damage as was once reported. Lo and behold, we're not just to blame. But I thought it was really interesting because if you actually read the study, it said, yes, we have been estimating the number of issues that have cropped up, mostly to do with like chromosomal abnormalities when it comes to egg quality. As we age, there's less of an impact than we've originally been giving. However, most of that is more due to ovarian environment as opposed to actual eggs. So the ovarian environment, this is exciting because this is something that you can actively change. Yay. With lifestyle and with therapies like acupuncture. So as opposed to just, I hate anything where it's like, well, that's just the way it is. Like your eggs are just the way they are. Your age is just the way it is. I hate anything like that. I like to know why something is improving, and I like to know what I can do to improve it. And I'm fairly certain that this audience falls into that camp as well. So in this case, improving the ovarian environment is what acupuncture is particularly good at. And it's doing that by supporting your neuroendocrine regulation and specifically circulation, as opposed to like creating more eggs. That can't happen. That's impossible. Actually, one of my greatest pet peeves now that I'm on here on my soapbox is she has a huge following, and she was recently on Diary of a CEO. She's a gynecologist in the States, and she is routinely quoted as saying that once you're in menopause, you have no more eggs. I hate that because it's not true. You still have eggs, you just don't have the hormones to support ovulation. So it's important to understand that you can't create more eggs. We also won't ever be without any eggs. And it's more about supporting the environment and not freaking out about things that you can't actually control, like, for example, your age. Back on topic, what else is acupuncture helping you with? If you are still with me and not asleep, it can. And this is my most favorite topic. You ready? No one's saying, yeah. I didn't expect you to reply. The immune and inflammatory pathways. If you want a longer, more detailed lecture on this, I put the Egg Whisperer to sleep on her podcast. If you watch the YouTube component, her eyes are in fact closing at certain points, and I did elevate the tone of my voice to keep her awake. I will do the same for you, as it is much later at this point. So this is all based on a Harvard 2020 study, and it is incredibly important because so many patients will come and say to me, I don't understand why you're doing these points in my legs when all the other acupuncturists are always doing points in my abdomen. Well, my friends, it is an evidence-based reason. So in 2020, researchers at Harvard published work in the neuron demonstrating that acupuncture can activate specific neural circuits that modulate systems, inflammation, and cytokine activity in animal models. And while this isn't a fertility study, and it was conducted in mice, which is important, it provides important biological rationale as to why acupuncture is so beneficial for inflammation and immune signaling, and how it plays a role in implantation and early pregnancy. And it also shows why acupuncture is capable of influencing these pathways through neural immune communication. So how do we put all this together? The evidence supports that acupuncture can regulate stress and autonomic balance. improve ovulation frequency, specifically in PCOS, support ovarian hormone signaling in select populations, like for example, DOR, improve blood flow and tissue environment, which has much to do with egg quality, and modulate inflammation pathways. Again, I'm framing acupuncture as a supportive tool, and it's an supportive integral therapy, not the only one. I don't believe that anything should work in complete isolation. So it's supportive to help optimize conditions under which fertility occurs. It works best when it's consistent, so between 7 and 10 days, and individualized, similar to your fertility treatments. It needs to also be combined with evidence-based medical care. And in my opinion, there's so much acupuncture research now that if your acupuncturist doesn't describe or give you rationale as to why they're doing certain points for you, then push back, advocate. I love it when a patient asks me, why are you doing this point? My patients, actually, they end up hating that they ask me these questions, but I love it when they ask me, why are you not doing more points in my pelvis? Why aren't you doing any points in my back? Why are you doing so many points in my legs? And then I can pull up on my phone like the most annoying person in the world and be like, this is why. Read this study. Get this. My patients hate it when I'm like, take a screenshot, take a picture of this. You can read it while you're here. They're like, believe it or not, and I don't, in fact, want to read about acupuncture while I'm here. Although to me, it makes perfect sense. You're getting acupuncture. Don't you want to read about acupuncture research? When I'm working out, one of the only things that keeps me working out is that I'm reading them the benefits. I literally will be like, what is the benefit of squat in between so I can keep going? Because otherwise I'm like, this is stupid. This is torture. Same could apply to acupuncture. So most of my patients end up just falling asleep like the egg whisperer. So if you are still awake and you have questions, I welcome them. I'm ready. And the crowd goes wild.
If anybody has questions, you can just put them right in the chat here. See some coming in.
Can I just, do you want me to hit this or
Yeah,
where do you
yeah,
want
go
me
ahead.
to, what would be better?
Go ahead and answer them as they come in and as you see fit. That sounds
Okay, great. Okay. Um, okay, so I don't actually use a ton of STEM in my practice. I have a community model, as you can see, so that I can see more patients. I roughly see about 40 patients a day, each with an individual protocol that I work with them to create at their very first initial appointment. I don't do a ton of electrical stim. That's what e-stim is. Simply because I don't think the evidence supports it. There's a few studies, most notably around using e-stim for like transfer success, but personally and anecdotally, I haven't seen a replication of those studies like Victoria and Steiner's studies and the improvement of outcomes. I don't think it, I think it's more about consistency and consistently getting acupuncture prior to a transfer than using electrical stim. I just think it's interesting. Everybody has their own frequency. And I think by changing that as opposed to just gently fine tuning your own frequency, you can end up overstimulated. I've never had somebody come in and say, "Oh, are you going to use electrical stim on me?" Never. And I think there's a tremendous amount of value in it when it comes to muscular skeletal work, MSK work, because you do need a more vigorous stim, you do need to maintain constant stimulation on the needle in order to have improvement in, for example, certain muscles where you're looking to improve blood flow, like really vigorously. But infertility, even though it feels tempting to want an extreme protocol, you're never going to get a good result. And I prefer to look at the studies that are based more on improving somebody's physiology over time than the few studies that were very well funded because they were tracked around like an IVF cycle. Um, like acupuncture research actually got a lot of funding because of fertility and because of IVF, and for that I am grateful. However, it also then got a boost of funding after COVID when they found that acupuncture improved the rate of well, survival actually from sepsis in China. So after that, there it's sort of like when Nixon went to China and recovered from a gallbladder attack by getting acupuncture. Then all of a sudden there was a tremendous amount of information and encouraging acupuncture in the States. So it doesn't mean that it wasn't beneficial before, but once there's like a focus or like a spotlight on a particular condition, and we can like make it more glam and slightly less accessible, then all of a sudden that seems to be what's happening. It's similar to like the red light therapy, for example. I, as you can tell, I'm well loved with my peers. There's an American acupuncture clinic in California that they really upsell their acupuncture treatments because they include red light therapy with it. And when I then wrote on this one post, like, I think this is tremendously damaging because there's no actual research that red light therapy can do anything for like rejuvenating the ovaries. That's only done by a laser found in Japan and I think Belgium. That's $30,000 USD. Like that there's good success with, and that there's a decent amount of research, but that is not the same as like a red light therapy that you can then purchase and use in office or at home. But most people wouldn't realize that. So it's sort of the same idea when you're using e-stim with patients, like they think to themselves, like, ooh, this is like really advanced. This is giving me more because it feels more invasive, it feels more extreme, but the result itself doesn't it doesn't render this like amazing result. So I don't use it. Longest answer ever, no, I don't use e-stim in my practice. And the reason for it is I don't think it's well supported, and I think that it doesn't really have a place in fertility acupuncture. They haven't really repeated the studies that were done in 2008. And I think anything that has longevity, you would be repeating multiple times. So there we go. I'm so sorry. That was so long. And since then, now there's a million questions. Okay, great. Super. Great. Does acupuncture improve sperm quality, motility, and the works? And the works. Well, one of the ways in which acupuncture can improve sperm is to have a very naggy and annoying acupuncturist who insists on lifestyle outside of just acupuncture appointments. So, similar to the ovarian environment and how acupuncture can benefit the ovarian environment by improving your overall health as a person with sperm, it can improve sperm quality. So if I can improve your digestion, your sleep, I can ensure that you are getting regular activity that hopefully is less cardio based and more weight based. If you can ensure that you're not spending excess time in heat, so like no hot showers, no hot baths, no saunas, no hot tubs, no briefs, only boxers. And if you can maintain, like if you're maintaining a regular acupuncture appointment, for the most part, you're probably able to remember to take your antioxidant supplements. So, can acupuncture itself alone improve the works? No. Can it be part of a multi-systemed approach to improve overall lifestyle and therefore reduce like oxidative stress? Yes. That being said, in Canada, but in Ontario and the GTA specifically, I find it very irritating that there are only really two reproductive urologists that are seeing patients. And for the most part, you'll have patients who have like varicoceles, clinical and subclinical, that are being told, like, well, this isn't affecting you, which makes me insane because if it wasn't affecting the patient, then the patient wouldn't be sitting in front of you. So I think it's really important that we are encouraging men or people with sperm to really advocate for their own health. I had one patient in particular who's actually a patient of Tripod, and he was really great. He had the success because honestly, Dr. D specifically, Dr. R is just as amazing, but Dr. D is really hard on male patients and ensuring that they are carrying their weight in the journey that is fertility. And it makes such a difference. And this one patient was sent to this urologist, a well-known urologist at Mount Sinai, and his wife at this point had had 5 back-to-back miscarriages. And when he had done his semen analysis, it was discovered that his DNA fragmentation was over, I think it was like 25%. And when he brought that up to the urologist is looking at his works and he's saying, well, I don't know why you're here. Like everything seems to be functioning. And he said, well, my wife has had 5 miscarriages. He said, well, it's not really affecting your fertility. What? That's insane. So I think the more that we can encourage our partners to, or if you're listening to this, the more that you can advocate for your own well-being and the more that we can get an accurate baseline, the better you'll be able to improve your sperm health and therefore your overall fertility. So advocacy, lifestyle, and once we've gotten all of that, acupuncture can be part of that picture as well. Is there any evidence that acupuncture helps with recurrent miscarriage? Yes, there is actually quite a lot of evidence that acupuncture can help with recurrent miscarriage. However, just like anything else, you have to know why you're having recurrent loss. So I would encourage you to first start with your clinic and get an RPL, a recurrent pregnancy loss workup. And some clinics are better with that than others. I think it's important that you get a DNA fragmentation in addition to your semen analysis because DNA fragmentation can contribute to 50% of all recurrent pregnancy loss. So that should be part of your workup as well. And in terms of what acupuncture can do, I've found that as someone who has suffered from recurrent pregnancy loss, I've had 5 miscarriages. And one of the most important parts of my puzzle was understanding the role of my immune system. And that's why I got so enthused and like excited by the research that's now happening about the effects of acupuncture and modulating immune activity. And so for me, I think a lot of my patients' success, especially a lot of my endometriosis patients, their success, if they have recurrent loss, acupuncture, I think, can have a very powerful role because of the way that it modulates pro-inflammatory cytokines, which can often be the reason why you're having recurrent loss if everything else is checking out to be a-okay. But again, you have to know why you have recurrent loss, and it's not good enough for people to just say, oh, it's bad luck. Oh, that's bad luck. One is bad luck. Two is really bad luck. Three is not luck. It's not bad luck. That's a diagnosis that you need to get. So, yes, acupuncture can help with recurrent loss, but the way in which it's helping, whether it's improving like PCOS, egg maturation, whether it's helping be part of the larger picture for semen analysis improvement, or whether it's improving blood flow because you have like a thrombo issue, like in all of those capacities, acupuncture can be once again supportive, but it's not the be all and end all. It's all part of a larger puzzle and putting all of those pieces back together. Should you do acupuncture for a certain amount of time before you start IVF? I think that's a really great question. Science would point to yes. There's a 90-day window where you can improve the ovarian environment that we have just discussed. And by improving blood flow and delivery of nutrients, you're going to have an improved outcome. You could be taking all the supplements in the world, but I find it's really tricky because I'll get a lot of patients will come and see me. They're going to do IVF next month and they haven't made any changes. Will it be failed because you haven't done anything? No. No. Something I really love to say more often than not, more than I should actually, is it's hard to improve egg quality, but it's also hard to ruin egg quality. Whereas sperm is the opposite. It's easy to improve sperm quality. It's easy to ruin sperm quality. So, do I think you should start as part of a larger lifestyle overhaul? Yeah. If you are already starting with good sleep, good activity, fueling yourself appropriately, not eating processed food, making sure that your stress is reasonable, and taking care of any like outlier medical conditions, like if you have uncontrolled anything, even if it's something that seems seemingly unimportant, like psoriasis, that's important because that's showing like what's going on with your inflammation. So if you are starting with a good foundation where every one of those is checked off as like, good, I've taken care of that, then you're already starting at a way better start point than anyone else. And if you're then holding yourself up because you don't want to start before 90 days worth of acupuncture, I don't know if I would wait. Now, if any of those are off and you're going to have to start anyway, or I'm going to start IVF in 90 days, then yeah, absolutely. It can be really supportive and helpful, as well as knowing why you're doing IVF in the first place. That's the most important thing. You should know why you are doing IVF because that will help me as well. People are so funny. They come in and they fill out their initial forms and they say, doing IVF. I'm like, okay, but why? Like, I'm not going to just give you my IVF points. There's no such thing. Well, I mean, there is, but I wouldn't recommend going to anyone who says that that's what they're going to be doing for you. Instead, I would want to know why you're doing IVF so that we can tailor your protocol. Whether it's like I have some patients that are coming because they're freezing their eggs. So they're overall very healthy and they just want to improve circulation. No problem. If you have severe endometriosis and you need to do a retrieval before you get surgery, okay, then we have a totally different plan than if someone was coming to see me because they have diminished ovarian reserve. The points that you're getting are going to be totally different. So it's really important that you know why and that you inform your practitioner. Moving on. How often should you get acupuncture when trying to conceive? Between 7 and 10 days. Because I think the research points that that's the most successful frequency, and I think it's the most doable. I also feel like when people are trying to fit in one more appointment, that's why I say 10, because sometimes people are like, oh God, like you're so far. Or like, oh, it's just another appointment. Oh, it's my God, it's so long. I'm like, well, then just come like once every 10 days. Try and do 3 times a month instead of 4 times. It makes a big difference. Um, let me see. Do you have any acupuncturist in Toronto you recommend if we're unable to book with you? So cute. I love you so much. It's actually very hard to book with me. I apologize in advance. My wait list right now is this is so unhelpful. My wait list right now is May. So let's bulk up on this one. Okay. So right now I'm actually not recommending any acupuncturists only because I have done that in the past. And then when a patient or someone has an issue with said acupuncturist, they then come and say to me, "Why did you recommend this person?" when it just wasn't a good fit for that person. So I think it's really important if you have a friend or like someone that you know as part of a support group, for example, that has had good success with an acupuncturist, ask them what they like about them. Because I, for example, would not be a very good fit for someone who would want more of a like therapeutic and like peaceful and, warm and fuzzy environment. Like I'm a very loud, laughy, obnoxious character who will be doing points that are very much based on the most recent evidence that I've accumulated from my like nightly binges on PubMed. Like if that sounds appealing to you, then I'm going to be a great fit. But that's not a great fit for a lot of people. Love the philosophical approach to acupuncture, and they're wanting someone who's going to be like checking their tongue, checking their pulses, and discussing, improving the warmth in their abdomen and like the various philosophical principles of like the Ming Men and like your overall kidney flames and while I find all of that very interesting, I'm not going to be treating you from that approach. So then if you came here and you expected that, that would be so tragic. You'd be like, oh my God, that nerd was the most annoying human being I had to spend 90 minutes with, kill me dead. So the most important thing you can do to find yourself a good acupuncturist is to look at reviews and to have a conversation with someone who your opinion you would respect and who knows you well and ask them like, do you think I'd be a good fit for this person? And that's I think the best place to start, as opposed to my recommendations, because I also didn't go to school. I got my doctorate actually in Vancouver. So the majority of my colleagues are either American, because I'm part of the American Board of Oriental Reproductive Medicine, or from BC. So if you want a good Vancouver acupuncturist, I've got quite a few. But those are the people I went to school with. So I'd be able to give you like more of a I know their personality and this would be a good fit for this sort of a person. But I actually don't know that many Ontario acupuncturists. I know a lot of Ontario NDs who are excellent. But they aren't necessarily going to be giving you the same approach because they don't get as much schooling with just acupuncture. Thank you, but so thorough. So cute. How often should you go for acupuncture if you're doing IUI or IVF? Again, 7 to 10 days would be the recommended amount. And is 7 to 10 days also the recommended amount for men? Yes. Yes, it is. But again, keeping in mind what your goals are specifically, because let's say, for example, you're getting acupuncture because you can't sleep. Well, then if you're only sleeping every time you get acupuncture, if you're only sleeping, 3 to 4 times a month, then you're going to want to go more frequently. So again, that's just a general recommendation that hopefully you can use to guide, a little bit more, a little bit less, depending on what your unique needs are. What nutrition and lifestyle advice do you recommend alongside acupuncture? So one of my favorite nutritionists, she was on my podcast. I have a podcast called Trying to Be Positive, and her name is Lily Nichols. She is phenomenal. I love her. Her research on nutrition, specifically as it pertains to fertility, prenatal nutrition, and gestational diabetes, actually, which is really important for anyone. I recommend that book actually for patients that I have who have PCOS, whose insulin levels I'm concerned about. I recommend, pregnant or not, that they read that book because it's a wonderful resource. So Lily Nichols, any of the guides that I give out in my clinic are all guided by her research and her books, because they're so up to date. She's always constantly rewriting them, coming up with new additions. And she's also publishing on her own Instagram, and on like PubMed specifically, new nutritional studies that are really, really relevant to the fertility population, as well as once you're through your fertility journey and you are pregnant, which you will all be at one point, she has books for you. So win-win. And then when you're an elderly hag like me and you're done, you can still find value in all of the inflammation that she's constantly going off about. So funny. I had one patient who told me if I said cytokine or inflammation one more time, she was gonna punch me in the face. I survived. Shocking. Lifestyle advice, it again depends on what's going on for you. Generally, movement is underrated and is not given enough attention, especially not in fertility, because so many people think that they need to be so delicate. There's very few conditions where you would not benefit from physical activity, namely hypothalamic amenorrhea, and if you are just fresh from an egg retrieval, and or you have PCOS and you're going to have an egg retrieval in a few days. In those instances, then you need to lay low. But otherwise, I feel like the majority of people don't make exercise enough of a priority. People will happily take supplements. They will happily get enough sleep. They will happily come and get acupuncture. But if I tell them they have to get a certain number of steps a day, all of a sudden, they're uninterested, which is too bad because it's really very important and very powerful for a lot of conditions in the fertility space. What else from a lifestyle standpoint? When it comes to male fertility, switch from briefs to boxers. There's a 2018 Harvard study done in August, and I think it was actually like August 18th, 2018. And they found a notable change in the semen parameters of men who switched from briefs to boxers, or when they were looking at men who wore boxers versus men who wore briefs. What was the most interesting part of that study is that even when participants in the study had less ideal lifestyles, like for example, a number of the men in the boxer category still were in the hot tubs and smoked, and they still had better sperm parameters than the men who are wearing briefs. Horrifying, but really important. So that's another lifestyle piece that I don't think gets enough attention that I wish did. I feel like I could go off at length about all of the various ways in which you could improve your lifestyle from a fertility standpoint, but then I would be answering just this one question for the rest of time. So we will move on. Is 7 and 10 recommended for men? Yes. For endometriosis, with the main focus on acupuncture be to reduce inflammation for fertility. So it very much depends, because like anything else, endometriosis presents very differently in different patients. Here's a wonderful example that also sort of weaves in the last question. So when trying to create a diet plan for endometriosis patients, one particular study was trying to see whether or not including more cruciferous vegetables in the diet of endometriosis patients would render a more positive result than just a standard Mediterranean diet. So you had Mediterranean diet, and then you had a Mediterranean diet with significantly more cruciferous vegetables. And they found in that population that a significant number of the participants actually had worsened symptoms, even though cruciferous vegetables are known to help detoxify estrogen, which is a big part of managing endometriosis. What ended up happening, though, was the digestive distress that was experienced by those participants ended up causing systemic inflammation, which then worsened their outcome. So, when you are treating an endo patient, you can't just think about it as a one treatment principle. Like, okay, I have to reduce inflammation because this patient has endo. Some of my endo patients, they have very severe endo that no one even knows they have until they go and get an assessment because they have no symptoms. They have no inflammatory symptoms. Their periods are normal. Their digestion is normal. Their ovulation is not painful. They have no nerve pain, no hip pain, nothing that you would qualify as like an endometriosis symptom pattern. And yet, when they go to the SUGO or they go and they get a procedure to determine whether or not they actually have endo, they have stage 4 endo, or they go to like a fertility clinic, for example, all of a sudden they've got like this horrific endo diagnosis. And so if I was to have that patient and I was to only be treating inflammation that wasn't present when they were in front of me, then that wouldn't be a very good treatment protocol. So it very much depends. In some cases, yes, and in some cases, no. It depends on how you present. So there's like standard treatments that I keep in mind when I see a patient. Like for my endo patients, there's one particular point called stomach 36, Susan Lee. And that I will, if I know you have endo, I'll work it in, but I'll be treating other parts of your symptom pattern as well. Like a lot of patients are on Orlissa or they've been put on Lupron. And so what they'll get while they're on those medications in terms of a point prescription will be very different than if they weren't, because they'll be experiencing things like hot flashes and sweats that they otherwise wouldn't be. So that was the longest answer ever to your question. But do I treat inflammation for endo patients? Depends how you're presenting on any given day that you see me. And although the research would point to that being the most important part of a treatment protocol for a patient, it doesn't mean that when you see me on any particular treatment day that that's what you'll be getting. Longest answers ever. I'm so sorry. Lauren Douglas, do you ever recommend treating everyone at once for the patient, the fertility issue, and that's right? I'm so sorry. I have to read this not aloud to try and understand it. What's wrong with me? To drink more of my tea. Any Curb Your Enthusiasms fans? I got this cup from a patient. I died with delight. Latte Larry's. Treating everyone at once for the patient, the fertility issue, and the psoriasis. Focus on the psoriasis for the fertility. Interesting. Okay. Love that thought. So I know a lot of acupuncturists have I had one teacher actually in particular who was very keen on using as few needles as possible. And so they would try to treat the patient with like a very simple protocol each time. I haven't found that to be more effective. Like, I haven't found that if I really focus by using only particular points, that I can have a better outcome. So, I would, if let's say you were coming to see me and you had psoriasis, but you also had PCOS and you weren't ovulating at the frequency that we wanted you to. We were concerned that potentially there was less blood flow. I would be working on, from that perspective, I would be working on improving blood flow, modulating the immune response for your psoriasis and helping reduce stress because that would be affecting both. Um, so there's certain points that I've found to be very effective for that, specifically, but not limited to Do 24, Heart 6 and 7, PC6, and I actually love the lung points. So I love lung 7 and lung 9, and I use those often, especially for patients that are presenting with skin issues because the lung and the large intestine are really important to treat when you have something like psoriasis, eczema, because it more often than not is coming from more than just, overactive immune system, dry skin scenario. And often it's more than just inflammation, it's dysregulation. So long answer, yes, I would treat it all at the same time. I don't limit my needles. Since we're in the clinic, I can actually show you, since you're all curious little cats. I use tacks. I really encourage any acupuncturists who are watching this to consider this because I have had so many patients who were previously terrified of needles. And these are just a beautiful little intro. These cutie little press tacks come in a sealed package like so. And I'll use these on the wrists and the abdomen because more often the patients dislike very much keeping their hands still and they don't like having needles sticking out of their abdomen. Shocker. So you can use these and they can move around without the fear of like impaling themselves, which helps with the stress reduction. But I also like when you're using these on the wrist and the abdomen, then it doesn't seem like you're using so many needles. You know what I mean? Even the needles I do use, I have like a Japanese style for acupuncture, which just means like a very shallow insertion with very fine needles, because more I have not found to be better, anecdotally and or in the research. What are your thoughts on using Fertility? Okay, well, that's not really an acupuncture question, but you know what? I'll weigh in on it because I'm a chat box. Um, I love Fertility in premise. I love the idea of it, but I found it is impossible with the Ontario healthcare system. Like I had one patient who was trying to get blood work for her fertility testing. She saw 3 different people because no life labs, it seems, these days are doing it because you can't collect the blood from life labs to then give it to DHL. So you end up with this stress, did it make it to Greece in the first place? Like getting my blood, getting my partner's blood, getting my swab, getting my period blood at the right time and keeping it in the freezer until I have my blood. Like it's just so complex. That being said, if I have a patient where I'm fairly certain that they have an immune issue and they can't be seen by a clinic that takes that seriously, then because I don't want them stalled, we will take every effort to find out whether or not their immune system, whether or not they have an alloimmune issue. I don't love it for like the microbiome from that perspective. I feel like why would you do that when you could get a CD138? I understand a lot of people don't like the idea of a swab, but ultimately I feel like it's going to be taken more seriously by more professionals. And the worst thing would be for you to go through all of that hassle to collect your period blood, send it to Greece. If it doesn't get lost, then having to redo a swab anyway because the practitioner in question doesn't necessarily use Fertility in their own practice. Like as an advocacy piece, you can use Fertility. I wish, and my feedback to them has been like, you guys need to have sort of a concierge available per province where you can help us find someone that's going to draw blood, help us with the whole delivery process. I love the Greek lifestyle where they appear to be on vacation the majority of the time, but it does not bode well for fertility because if you're not there on Monday and you're not there on Tuesday and you have a long nap on Wednesday, like when are you getting this done? We need this done, people. So, I think if we could get through some of those more administrative details, then there's like wonderful potential. But as it is, I found it to be kind of annoying and irritating for my patients. At what stage after lifestyle changes, medications, vitamins, acupuncture, and so on would you suggest moving on from naturally trying to IUI or IVF? So that's really important. That's an important question. I think that it's really important to understand when you've actually arrived at the starting line. So this applies to anyone who has like male factor issues. This applies to anyone who has had a polyp. This applies to anyone who has had immune related issues. So often, I even had one patient where she didn't have a period, like at all. And she said to me, I'm just so tired of trying. And I said, not to be disrespectful in any way, but you're not ovulating. So therefore, we can't qualify this as time trying. So because everything for me ends up being a track related analogy, you can't start the timer for your race if you don't have your shoes on, if you don't have your shorts on, and if you're not even at the race yet. So we have to figure out, is your sperm ready? Do you have any polyps? Because if you do, you might as well just be trying with an IUD. So those two things, very important. Do you have an immune related concern? If so, you need to go to a clinic that can address that, get the appropriate testing, find out whether or not that's something that's holding you back. The issue that I so often take and where people will not have success is if they are doing IUI or IVF because of an unexplained diagnosis. If you don't know what you're treating, then why on earth would you opt for the most invasive and expensive treatment? To find out. I have one patient who she moved on to IVF and she made, out of 6 eggs retrieved, she made 5 euploid embryos. And she was so excited, but I was not so excited because if she made 5 euploid embryos and had previously only had chemicals to this point, then we know that they're being fertilized, eggs are being fertilized. We know for, as much as anyone can know anything, that the chromosomes are not the issue here. So what is happening in her body that then is impeding pregnancy? So then when she didn't have a successful transfer, not once out of those 5 times, it's heartbreaking, but it's also like we never found out what was wrong. So, and until you know what you're treating, you can't decide whether or not it's the appropriate treatment protocol for you. So, in terms of moving on, I think you have to arrive at the start line with all of the cells that you potentially need in the best working order. You need to know that your uterine environment is hospitable, and you have to know that your immune system is not hyperactive, NK cells aren't overactive, cytokines aren't too high, and preferably if you need to know leukocyte antibodies, so like your LAD scores, something that you can take into consideration as well. If you have been trying for an extremely long time and it seems as though nothing else is wrong, I think it's important to totally understand the full picture before moving on. And okay, so I feel I don't know if this is a natural wrap up, but um, which immune clinics do you recommend? Well, I don't know. This is pretty controversial. But I'm a big fan of Tripod. I feel like Tripod's a really fantastic clinic. I feel like the doctors are constantly trying to improve themselves and improve the outcomes of their patients by staying on top of the most recent research. I feel like all of the advancements that they're making are for their patients as opposed to for their clinic. And I like clinics that take IVF round by round, as opposed to um, telling a patient, we're going to need 3 rounds before they've even done one. You have no idea how many rounds someone's going to need to do until you do it. Someone will present with potentially a really low AMH, but like relatively decent AFC. But if you're going simply on the AMH and their FSH, and you're not looking at like why their AMH might be low, like common causes could be they have endometriosis, something really dumb, like, oh, they have really low vitamin D. Like that's going to impact your AMH. So that test should be done at the same time. And if it's not, then I mean, it's a pleasant surprise to have, but you could also end up overstemmed. So all to say is that would be my preference in terms of an immune clinic. I think that they are top of their game. And I always like to look at um, how much does a clinic care about my patients and how much time are they spending communicating with the practitioners that are seeing these patients. And the communication from the clinic, with me at least, is excellent. And I feel like I can have really amazing working experience. And then as a result, the patient feels a lot more comfortable because they know that their practitioners aren't putting heads. So, I hope that that was helpful, guys.
Okay. Thank you so much. Thank you so much for your time, Anne. That was
Yeah,
awesome
no,
and so thorough, and I think everybody got a lot out of that. So, thank you. And thank you for your time.
pleasure.
I just wanted to mention that our next webinar, PGT, When to Consider It and When It Matters with Andrea, Canadian Certified Genetic Counselor, is on Tuesday, February 24th at 12 p.m. EST, and you can register at fertilityfriendsfoundation.com. Thank you, everybody, for joining. And thank you so much, Anne, again. Thank you.
No problem. My pleasure. My pleasure. Whoa, there was a lot of you guys. You're all
Yeah.
popping up now. I can only see like 3 names. I was like, look at me. So informal. Nope. Terrifying. Thank God I didn't know. Okay.
Thank you, everyone. Wonderful
I,
night.
I don't even know how to sign off of here. Do I just hit this little man with the door? Or are we
Yeah.
gonna stay on and chat? What's happening?